fairly been healthy all my life, every now and then common colds. Starting January of 2024, I started feeling, I would go work out. Then I started noticing some chills. I think it was mid-May that I told Melissa, hey, I think we need to go to the hospital. I mean, something's off. I'm getting fevers daily. I'm losing weight. I mean, I'm not feeling good. We go to Baptist South here that's UAB affiliated. I remember in the emergency room, they did a CAT scan of my chest, again, abdomen. The chest didn't show anything. The abdomen showed my spleen was a little bit larger than last time. We came back to Montgomery, and Melissa tells me, I think it was a Friday, she tells me, look, we're going to rest today, have your day, rest, but tomorrow we're going to UAB.
My name is Gaurav Goyal. I am a hematologist oncologist. I'm an associate professor in the Department of Medicine and the Division of Hematology Oncology. I am focused on blood cancers, especially lymphomas, but I have a very specific focus for several years now in rare histiocytic disorders like HLH. I call this disease, it's a mouthful if you're ready for it. It's hemophagocytic lymphohistiocytosis, HLH. No matter what you call it, it's really basically telling you that your immune system is harming you. Now, we all get fevers, right? So a little bit of fever here and there is protective, actually. A little immunity is good. But here in this situation, it's revved up so much, your organs are basically failing. So it's another term for this is cytokine storm, where your body is just throwing these chemicals that are making you sick.
At that point, the hematologist, they were fully, I think 100% sure that this was HLH. They discussed with Dr. Goyal at that point, who's the HLH specialist at UAB. At that point, they decided to consult the surgeons.
Time is critical in these diseases. He was in the ICU at that time. I recall his wife having to talk with our team that really we are looking at nearly 100% mortality if nothing was done. So it was very critical to make that decision on what to do next, because we were at a situation where the blood count was so low that we couldn't do a spleen biopsy. That was risky. Couldn't do chemo because we didn't know what was going on. We need to know the cause. And the spleen was enlarged, so we knew that was where the problem probably is. So getting them all together, explaining to the surgeon, Dr. Reddy, was great.
My name is Sushanth Reddy. I am a surgical oncologist here at UAB. I focus primarily on pancreatic and liver diseases. I remember how this started. Dr. Goyal called me on one evening and said, I've got this patient who's likely got HLH. As I understood it, HLH is primarily a disease where you treat the underlying malignancy, the lymphoma, with chemotherapy. But in his case, he was too ill to even get to that point. And the only way that they could foresee him actually surviving is if we took the spleen out. We spoke at length, and we ended up having a multidisciplinary meeting that night with our anesthesiologist. We had a Zoom call with everyone on board to try to figure out the best way to deal with this.
At that call, we all understood the gravity of the situation. Because sometimes when you just look at the chart, you're like, okay, this patient is too sick. Splenectomy? No, I'm not going to do that because it's maybe 20% mortality. But when the mortality without doing the procedure is 100%, the risk-benefit ratio changes quite a bit.
He told me, that if we don't do this, you probably have a week or 2 weeks left, if anything. And Dr. Reddy told me the problem is that if I take you to the OR table, you may not survive either. You may bleed out. And I remember I told Dr. Reddy, hey, doctor, do whatever you need to do. I want you to take me to surgery, do whatever you need. I trust everything's going to go well. I was scheduled for surgery the next morning.
We took him to the operating room and we took his spleen out relatively quickly. And it was quite remarkable to watch. Over the next 12 hours, all of his numbers got better almost instantly after getting that spleen removed. To the point where Dr. Goyal was asking me if he could even start chemotherapy right away. Starting chemotherapy with someone having an open abdomen is unheard of. But again, this is an unheard of situation. he started getting better. They didn't give him full dose chemotherapy for another week or two, but they were starting some of the therapy. But he started getting remarkably better. The following week, I reluctantly let Dr. Goyal start full dose chemotherapy, and the guy made a full recovery. It was incredible to watch.
He's done so well over a year, and I am very hopeful that the lymphoma will not come back. He finished the treatment like a champ, like he had no side effects. I sometimes joke, like, did we give you the real thing? But he tolerated it so well. The inflammation markers have stayed down. I learn from each patient. And actually, ever since his case, we now definitely look at the spleen for sure. And in our education sessions to our trainees, we include his case as an example a lot of times to highlight. I see the value of having a comprehensive cancer center as going beyond just knowing, okay, what is the cancer? What do the guidelines say? What treatment to give? There are so many unmeasurable benefits that can ensue just by having a big team working on your case. The other strength of coming to a comprehensive cancer center like UAB is that you have clinical trials that are really life-saving. Study has shown that patients who participate in clinical trial have good outcomes. And in fact, after this case, we opened a clinical trial for HLH. So now we do get referrals for HLH from the community, because if patients are sick, the oncologists call us, and our numbers are with everyone in the community. I think that ability to have all these experts under the same roof is really unmeasurable. So because this is just this one story that highlights the importance of such a setup.
At UAB, I always felt welcome. I trained at UAB Montgomery. I graduated from UAB Montgomery. Never in my life I thought I was going to be a patient of UAB. I knew that when I got really sick, that's the place I needed to go. I know the great quality of care that they had. I knew that they were known for their care. I've transferred patients to UAB, Birmingham, a million times, and I know that that's where you go if you need answers, and the answers you want. UAB is a top-notch facility that I have no objection recommending first line in cancer care. Dr. Goyal is excellent. He's got credentials that back him up, and rheumatology team, I think they're top 10 in the nation. Surgical team, Dr. Reddy, was excellent. I mean, I would recommend at any point, UAB as a place to be taken care of. Cancer is multifocal, multi-team approach to defeat it. You need good doctors, you need family, you need friends, you need faith. It's all together. It comes together to beat that obstacle and to overcome it.